Treatment and management of ADHD can be summarized as follows. Collect a detailed chronological history of establishing that these symptoms did exist before the age of 12, that caused a little bit of impairment at least then, but now the same kind of symptoms are now causing significant impairment. So that's one. We also look at genetic history and identifying, if possible, establishing either low birth weight or any kind of family tendencies of ADHD, not only in the parental generation, but also uncles, aunts, and grandparents. Often ADHD traits are more prominently seen in male members of the family, and in female members, it's a little bit harder to pick up. Once the diagnosis is clarified clinically, we also obtain some collateral from school, and we do that by looking at school reports, because often hidden in between all the sparks in a child are comments like, could do better with submitting assignments on time, has great ideas, but reports are frugally written, or could use more practice. These are hints that become more valid once there is a clinical diagnosis of ADHD that's established. Traditionally, we also want school collateral, like asking a teacher to give feedback, and that's how classically ADHD is diagnosed in the West. But in the Indian context, sometimes because of lack of awareness, sometimes even if a teacher does see those symptoms, they might not see it as part of the ADHD spectrum. So there is a risk of a false negative. Now, once the diagnosis is established, we work with the family to help them understand the difficulties that they are having from an ADHD standpoint, and that some of these difficulties are outside the control of the child. Then we work on the family to create empathy around this being a biological issue. That means that the child may or may not have control over this. That creates a little bit of empathy in the family or the parents. And we then tell them that, your empathy doesn't lead to the child getting a free hand. Your empathy only creates a safe space for the child, where you're saying, I know you will get distracted. I know this tuition will be very hard for you to attend to, but then it leads to a sense of accountability of, okay, how do I help you not get distracted? How do I help you not forget your assignments to be submitted on time? So that's how we work with the parents. With the child, we encourage them not to take blame for these mistakes, not to take blame for the multiple times where they forget to switch off the lights, or forget other things, or forget why they went to the kitchen in the first place, or things like that. Once they are not taking blame, then we ask them to take responsibility. That yes, I make mistakes consistently, but I will try to see what I can do to fix it. Till the child lets go of the blame, and till the parents develop empathy, it's very hard for the child to take responsibility and for the parents to create accountability. In an ideal setting, what ends up happening is, like 6 months down the road, when we are wrapping up work, the child says, Mom, Dad, today I have this extremely boring social studies or history paper to write. Can you please get me started? Because otherwise I'm just going to delay till 11 o'clock or 1 a.m. in the morning. And the parents say, yes, sure, I can understand that this will be very boring. Let me get you started. But why don't we start right now? Because let's do this quickly before dinner time, and then you can come back to me in an hour and see how things are going. But I do understand that this is this is going to be hard for you, but not because you don't understand the material, but because just the format of putting all your thoughts down, typesetting, spell checking, organizing, submitting is going to be hard for you. So this is how it looks in the end. But for that, the first two things, right? Empathy for the parent and the child not being defensive and taking blame have to be done away with.